are going to be doing cervical goniometry measurements today with my patient Nick. So, first things first, we are going to be doing cervical flexion. Normal cervical flexion for a patient would be 0 to 45 degrees. Cervical flexion is going to simply be bringing the chin and the nose towards the chest. When you are ready, you can perform cervical flexion. Let's try that one more time, all the way back down. There we go. The landmarks that I'm going to be finding for cervical flexion goniometry are going to be the tragus, the base of the nares, while my stationary arm is going to be perpendicular to the floor. I'm going to line the fulcrum up with his tragus and then move the moving arm to the base of his nares. Alrighty, whenever you're ready, we can do cervical flexion. Alrighty, our patient here has performed 80 degrees of cervical flexion, which would be much higher than the normal range of motion for cervical flexion, meaning that he may be hypermobile or just flexible. So now we're going to use those same landmarks and we're going to do cervical extension. So cervical extension is just simply going to be bringing the back of your head to the back of your back. When you're ready, go on back and up. We are going to keep the trunk stable and only move the cervical vertebrae. And back up. Alrighty. Base of the nares, perpendicular to the floor, and using that tragus as well. Whenever you are ready, you can do cervical extension. Alrighty, Nick has given us 65 degrees of cervical extension. As you can remember, our flexion measurement was much higher than 60 degrees. So this means that Nick has limited cervical extension and extended cervical flexion. For the next measurements, we are going to be I'm going to be sitting behind my patient. Thank you, patient. And now what we're going to be doing is we are going to be measuring how far our patient is able to touch his left ear to his left shoulder, and then his right ear to his right shoulder. Alrighty, so the landmarks that we're going to be finding right now for this is we are going to be finding the C7 spinous process. If this is unable to be palpated just by visual eye, you can have the patient perform cervical flexion, and C7 will pop right out for you. So our fulcrum is going to be in line with C7. You can come back up. And then we are going to be having the moving arm in line with the midline of the skull, as well as the stationary arm perpendicular to the floor. Alrighty, whenever you are ready, we are going to be moving towards the left side. Alrighty. Our patient has given us 39 degrees of cervical flexion to the left-hand side, which is going to be less than the normal range of motion, which is 45 degrees. Let's see what Nick's range of motion on the right-hand side will be. We are going to find that C7 spinous process again. Come back up. Align our goniometry fulcrum with that. Stationary arm perpendicular to the floor and moving arm in the midline of the skull. Alrighty, whenever you're ready, we're going to go to the right-hand side. Alrighty, our patient has 36 degrees of lateral flexion on the right-hand side, which is once again below the normal range of motion value for lateral flexion. So the last measurement that we will be taking today, we will have Nick face the camera, and I'm going to sit on the table behind him. Kneel, actually. In order for this measurement to be valid and reliable, you need to be able to see the top of the patient's head at the exact top. You cannot be slightly underneath, or else your measurements will not come out correctly. The landmarks that we're going to be finding for this today are going to be the apex of the head, which is the center of the head, and then your stationary arm is going to be pointing directly forward through the midline of the head. Your moving arm is going to stay in the midline of the acromion on the shoulders, as well as the ASIS on your pelvic bone. Alrighty, whenever you're ready, we are going to rotate only your head towards the right-hand side, and then we're going to go towards the left-hand side without moving our trunk. Okay. Whenever you're ready, we can go towards the right-hand side. There we go, and back, and now towards the left-hand side. Back. Let's try to just move the head. And back. There we go. Much better. All right, now we are going to be taking the measurement. Normal range of motion for cervical rotation is going to be 0 to 60 degrees, but it can also go up to 79 degrees. So 0 to 60/79 degrees. 89 degrees. 89 degrees. 0 to 60/89 degrees. All right. Get those landmarks lined up. And whenever you're ready, we are going to be rotating towards the right-hand side first. And back. Nick has 90 degrees of rotation on the right-hand side. And I am so sorry, but you are... Your stationary arm that is not moving is in line with your acromion and your ASIS. Your moving arm is going to stay in line with the midline of the skull. Now we're going to go towards the left-hand side. And our patient has 90 degrees. Has 90 degrees of cervical rotation to the left-hand side. All of Nick's values are going to be functional values. However, his side bending, lateral side bending to the right and left-hand side are going to be where he's going to need the most work.